Good morning, ladies and gentlemen. Welcome again. I am Dr. Nik Nikam. You're listening to All India Radio Houston, and you can listen to us on KULF 1090 AM, and also you can listen to us on KULFradio.com. And later on, you'll be able to see this interview on YouTube. Now we're going to switch gears and talk about Social Security and Medicare. With the baby boomers retiring and knocking at the doors of Medicare and Social Security, I thought maybe this is a good time to talk about Social Security and Medicare, what is covered, what is not covered. And my special guest is Sudhir Mathuria, who is an insurance agent with almost 3 decades of experience. So we're going to definitely learn. And if you have any questions, the ladies and gentlemen, the number to call here is 281-983-9550. Okay, let's begin. Sudhir, welcome to All India Radio.
Good morning, and I'm glad to be here.
Okay, so let's start with what is Social Security?
Well, Social Security is a safety net,
Yeah.
and what it stands for is essentially old age, survivor, and disability insurance.
Okay. Who is eligible for Social Security?
Uh, any citizen or legal resident who contributed in the system by way of paying the Social Security taxes and Medicare taxes become obviously eligible for that. Uh, but there are some exceptions.
Oh, okay. Uh, when is a person eligible for Social Security and how do they apply? Or do they have to apply?
Essentially, yes, they have to apply for the benefits. And uh, the retirement age, so to say, is 62 year onward, and the full retirement age can be 66
Yeah.
or 67, depending on which year you were born.
Oh, I see. Okay. Where do they go to apply for Social Security?
It's a Social Security office, in any metro area or even the other areas, they have various offices. So that's the best place to go and apply for it.
Can they apply online?
They can apply online. However, many a times they ask the beneficiary to come and show the ID, etc.
Yeah.
So it can happen.
That's interesting. Ladies and gentlemen, you're listening to All India Radio Houston. We are talking about Social Security and also Medicare. My special guest is Sudhir Mathuria. You're listening to 1090 AM KULF. If you'd like to join in the conversation, or if you have any questions you would like to ask our guests, the number to call here is 281-983-9550. My next question is, how much Social Security can a person expect? And is it related to their pay, length of work, or any other factors?
Absolutely, yes. The payment has a complex, so to say, formula, but essentially you can say that it is calculated on the basis of primary insurance amount,
Yes.
known as PIA.
Yeah.
And then there is a formula. There are 4 tiers and percentages, and also the lowest amount over a period of years and the highest amount. So it definitely depends on how much a person has earned and contributed in the system.
Okay, let me give you an example. A construction worker who makes like minimum wages compared to a CEO who gets $10 million salary. Does the CEO get like 100 times more Social Security than the construction worker?
Well,
I was going to
that's
say a plumber, but a plumber makes more than a doctor, so I was not going to use that.
No, that's an excellent question. Ordinary wage earner will obviously get much less. Um, and somebody who contributed maximum, because there is a limit to which one will contribute. And 2014 limit is on an individual basis $117,000, which is taxable amount. and beyond which is not taxed per se. So, yes, the person who contributed more will definitely have a much bigger retirement check per se versus somebody who contributed much less.
Is this indexed to the income that for which you are paying social security, or is it just one flat cutoff after a certain limit?
It has both woven into the formula.
That's interesting. Ladies and gentlemen, we are talking about Social Security and Medicare. My special guest is Sudhir Mathuria, who is an insurance private insurance agent, and okay, and he's a health and wealth advisor. He has got his own practice. Okay, let's talk about. Let's say a spouse is not working. And is that spouse eligible for Medicare when he or she turns 65? If the
Yes.
other spouse has been working.
Yes, and that is a very good question. And absolutely, the spouse becomes eligible for the benefit on the basis of the other spouse who has contributed in the system. So, yes, the spouse will be eligible. However, depending on when the spouse wants to draw the benefit, whether it is at an early retirement age, let's say 62, or a full retirement age at 66 or 67. So there is a so-called a calculator that gives a pretty good idea on how much it will be. But rule of thumb is 50% of the primary spouse who contributed in the system.
Well, let's say, for example, let's take a Desi couple. You know, Mr. Patel, I would just, or you can say Mr. Nikam, who has worked, the spouse has not worked, and they both turn 65 or 66. So are they going to get more than what one individual would have gotten?
Um, well, essentially, the primary spouse, the
The
person,
working.
the working person, uh, will be the one which is a source,
Yes.
so that the other spouse who did not contribute in the system will get of half the amount
Yeah.
of what the primary or the contributing spouse is eligible for. So it's a 50%, pretty much. So,
Okay. How difficult it is to apply for Social Security and get the benefits, and at what age would you recommend people to get their benefit initiated?
there is no such a clear-cut answer for this because at age 62,
Yes.
when you are eligible to draw the Social Security benefit, you will be able to uh, get the benefit. However, it will be at a reduced amount,
I see,
and the
yeah.
percentage reduction is 25%.
I see.
So if you need the money, yes, you might as well go ahead and start drawing the money because just life is unpredictable.
Okay, the next question is this Social Security benefit taxed? And if so, at what rate?
Well, there is a exemption amount.
I see, yeah.
So uh, there is a initial, say, approximately $14,000 or so.
I
And
see,
I
yeah.
don't have the exact amount in front of me.
Okay, that's fine, yeah.
But I think it's and also in 2014, it's 41,400 is the max altogether
I see, yeah.
that can be exempt.
Ladies and gentlemen, you're listening to All India Radio Houston. I am Dr. Nik Nikam. We are talking about Social Security and Medicare. I know a lot of us are turning into the Medicare age and knocking at the doors of Social Security and Medicare. And if you are there and you have questions, you would like to know more about Social Security and Medicare, give us a call here. The number is 281-983-9550. You're listening to All India Radio Houston. You can also watch this on YouTube later on. or you can listen to us on kulfradio.com. Now let's switch gears. I know we got 30 minutes, and I don't think we'll be able to cover even the definition of Social Security. Let's switch gears. We got another 15 minutes or so, and move on to Medicare. You know, it's Medicare A, B, C. I don't know if they're going to come up with more letters. Let's start off with who is eligible for Medicare and when is Medicare going to be effective? It's the same questions like Social Security.
Right, and
Then we'll go into the ABCD alphabet soup.
and since you mentioned about definition of Social Security,
Yes.
I would say that Medicare benefits are part of Social Security Act.
I see.
You can say that because it is the Social Security is the one that initiates the Medicare benefits. So when person turns 65 and has contributed in the system at least 40 quarters, that means 10 years towards Social Security and Medicare taxes, then the person is, eligible to draw the Medicare benefits. So that's when at 65 it begins.
So, do they have to apply for Medicare?
If the person is already drawing Social Security benefits, then that individual is already in the system. As a result, the Medicare benefit ID card or the enrollment is automatic.
So, they automatically mail this?
They automatically mail it to the individual who is already drawing, who is already receiving the retirement benefit from Social Security. But if you are not drawing the benefit, then one has to literally go into the Social Security office and apply for the benefit, or one can do it online as well. But many a times they do want individual to come in.
Yeah, I think, I have looked at some of these things for research purpose. When you go, it's pretty straightforward to apply online for Medicare benefits. But of course, your date of birth and your name, everything has to match with what is on your Social Security card when you got it 30 or 40 years ago. If it doesn't, that's where I think it gets kind of so sticky.
That is very true, and many times they want to check the nationality or the person's identification. So they do invite the individual to come in.
Ladies and gentlemen, you're listening to All India Radio Houston. I am Dr. Nik Nikam. If you'd like to join in the conversation, give us a call. The number is 281-983-9550. We are talking about Social Security and Medicare, and this is going to be on YouTube later on today. Okay, let's talk about this A, B, C, D alphabet soup in Medicare. And my special guest is Sudhir Mathuria, and he is a health and wealth advisor. And you can reach him at 713-771-2900. Okay, Sudhir, let's talk about this alphabet soup, A, B, C. Let's start with Medicare A.
Yes, it's very interesting, isn't it? Part A is a hospital insurance. Part B is a medical insurance, they can say, or insurance for outpatient or anything outside of the hospital. D is the drug coverage, which was actually enacted back in 2006 under the Modernization Act of Medicare. And the combination of Part A benefits, Part B benefits, and also the drug benefits most of the time is known as Part C, or Medicare Advantage Plan. Many private companies, they contracted with Medicare and agreed to deliver this at minimum the same benefit under Part A and B in a private manner, similar structure to the job structure. And this is a Medicare Advantage Plan, or Part C.
Okay, well, let's explore a little more on Part A. What is covered, what is not covered, and is there a premium for Part A?
Part A is, like I said, is a hospital insurance. So if a person is hospitalized, then Part A is essential. And there is a deductible for Part A. And this deductible is a 60-day cycle. So if one is in a hospital for a 1 day or 10 days, this year deductible is about $1,214. After 60 days, if the person is continuously in the hospital, then the per day charge is approximately $296
You mean they charge $296 per day
per
for
day.
being in the hospital after
Being
60 days?
that after 60 days.
Oh, okay.
Uh-huh. And then after another 30 days, the charge doubles. So it becomes, and there is no cap per se under the Medicare, the health coverage.
So if you, for God forbid, if you're like a brain dead or something, if you're there for a year, then it's going to run into.
That is a very good question. The maximum allowable number of days on a continuous basis is 150 days under Medicare Part A. So after 150 days, uh, only either you can help yourself or God can help, because there is no coverage from Medicare.
So are these people eligible for the state insurance, which is the Medicaid, under those circumstances?
It is possible, but again, the person should not have any kind of resources or income per se.
I see. Yeah.
So it is pretty stringent. So somebody with any kind of means, some kind of retirement resources, will not be eligible for that.
So this Part A, when you say hospital, doesn't mean it covers everything. What are the things it doesn't cover?
Anything outside of the hospital. Part A will essentially cover hospitalization,
Yeah.
nursing home, uh, home health care. This is one
Yeah.
kind of a tricky thing, but because after hospitalization, you might need some kind of a skilled care, so it is under Part A, as well as incident like hospice.
Oh, okay. What about the long-term acute care, or LTAC as it's called?
The acute care, as long as it is acute and within 90 to 100 days, there is a possibility with a doctor's certification. However, if it falls into any kind of longer period, then it turns into a long-term care, which is not covered by Medicare.
Looks like a lot of things are not covered. More things are not covered than what is covered.
Well, it is, one has to plan, one has to think about it, and there are various supplemental plans available. Also, long-term care plans are available. Those who really want to be serious and plan, that really goes a long way, and it helps and have a peace of mind to the individual and a family.
So there you make a very good point, because most people think, oh, I'm getting Social Security, I'm getting Medicare, everything's going to be covered. I mean, this is our attitude. I mean, even professionals, they come to my office and say, well, he's got Medicare, everything should be covered. I said, no, you got a copay, you got to pay the deductible, and you got all other expenses. Some of these tests are not covered and all this. Ladies and gentlemen, we are talking about Social Security and Medicare, and my special guest is Sudhir Mathuria, who is a health and wealth advisor. That's why we need to contact somebody like Sudhir if you really want to plan your Medicare and Social Security in such a way that the cost of healthcare and all the other ancillary services are going to be at the minimum. And you can reach Sudhir Mathuria at 713-771-2900. You're listening to 1090 AM. Now let's move on to Medicare B.
Part B is, like I said, it is a outpatient. So if one wants to visit a doctor, wants to have any kind of outpatient service or surgery or procedure, uh, or say, for example, a laboratory test or MRI, or for that matter, any kind of therapy, any other rehab uh, type of service outside of the hospital area, then it is covered under Part B. And it is very essential many times because there is a premium to that. And the premium is $104.90 for someone whose income is, you can say, in a regular mode. But if somebody who has a high income, then it can be higher depending on how much higher income a person has earned 2 years prior. So it's a little
So
bit
does this
involved.
Medicare Part B have like annual deductible and copays?
Part B has a $147 deductible at this time. It is subject to change depending on how Congress acts and CMS decides. And there is a co-insurance, which is 20% of the Medicare approved amount.
Okay. Okay, ladies and gentlemen, you're listening to All India. We got another 5+ minute to go. I think we have to cover part C and D. And ladies and gentlemen, if you have any questions, if you'd like to join in the conversation, the number to call is 2819-839-550. You're listening to All India Radio Houston, and my special guest is Sudhir Mathuria, who is a health and wealth advisor. And you can reach him at 713-771-2900. Looks like we got a call. Let's see if we can take this call and before we proceed. Hello, you're on air. Go ahead, please. Go ahead, please. Yeah. Okay. Very good. Yeah. Let me ask him because he's not able to hear. Okay. The question is, if somebody is in India or Pakistan or Bangladesh, overseas, and they get sick, will the Medicare pay for those healthcare costs?
Medicare does not cover anybody who is outside of U.S. territory. That is, Medicare does not cover. However, if you planned, and let's say if you have some kind of a supplemental coverage or some kind of a Medicare Advantage plan coverage, then there is some provision to be covered for emergency only. And that is emergency only, not for regular day-to-day stuff.
Okay. Thank you very much, sir, and we appreciate you calling us. Okay, well, we got a couple of more important things we need to cover. Okay, we were talking about Medicare. Let's talk about D, and then we'll come back to C.
Oh, sure.
We got 4 minutes left.
Part D, or the drug coverage,
Yeah.
is very, very essential. It is there is an extra premium for that unless you are covering yourself under Medicare Advantage plan. Then it can be without any additional cost.
Well, I can tell you because I did some research. The additional cost, on, at least for an AARP drug program, is like anywhere from $25 to $50. But if you look at one medicine can cost you $200, then I think it's worthwhile having this Medicare Part D because it can drastically reduce your overall healthcare prescription costs. And there's this donut hole. Maybe you can describe in like 2 sentences. Then we'll move to Part C.
Current donut hole, or the initial coverage amount, is $2,860. However, under the so-called Affordable Care Act, or Obamacare, so to say,
Yes.
Eventually by 2020, the donut hole will be slowly phased out. So that's a good news.
But we still have to pay. So you're saying from 2,800, whatever it is, up to what that people have to pay? Full
the
amount.
current amount is 4,550, which is the donut hole or the coverage gap.
I see.
Okay, and once the person reaches that $4,550 of coverage, or the actual, out-of-pocket expense, then it becomes catastrophic coverage, and
Yeah.
the amount is very minimal. The beneficiary pays.
Okay, we got less than 2 minutes. Let's talk about C, which is a combination of A, B, and D.
A, B, and D equals C, and the Medicare Advantage plan is uh, offered by private companies. They contract with Medicare on a yearly basis, and in turn, whoever wants to join Medicare Advantage plan will also sign up with that particular company, and you have to follow that particular company rules, and or also the network. So it is they do provide all the benefits under Part A as well as Part B, and many companies will provide more benefits over and above Part A and Part B benefits offered by Medicare.
My special guest has been Sudhir Mathuria, who deals with health and wellness. He's an advisor, and his number is 713-771-2900. We are talking about Medicare and Social Security. Sudhir, that's all the time we got, and
I know.
thank you very much for being
I
on.
appreciate the
Being on
invitation.
All India Radio Houston. Gentlemen, my next guest is here who's going to start his program, and we'll be back next Saturday at 10 a.m. Until then, have a wonderful weekend.
Thank you.
Okay, I can do this. Huh? I can do this. Yeah, okay. Okay.